Locally, Governor Mark Dayton today unveiled a sweeping plan to fight Minnesota's growing opioid abuse crisis, including a steep tax on drug manufacturers.
395 people died in Minnesota from opioid overdoses in 2016. That's an 18% jump from the year before. State leaders say it is getting worse.
Pat Kessler's here with more on this plan.
Yeah, getting very, very serious. Lawmakers say that the Minnesotans that are dead from opioid abuse in Minnesota is bad enough, but thousands more become addicted every year. That's why they are proposing drastic and controversial intervention.
The opioid epidemic sweeping across the state shows no signs of slowing down. The number of overdose deaths growing by 66% since 2000. That's why state officials are taking the unusual step of taxing opioid manufacturers for every pill they sell in Minnesota.
You can call it whatever you want. It means that they're going to pay for the product they're producing is causing this epidemic.
The intervention plan charges opioid manufacturers about a penny for every milligram prescribed and sold in the state, raising about $20 million a year, the money for law enforcement, emergency responders, treatment, and recovery. For two state lawmakers, it's personal.
We think this is the right thing to do today because we've never seen this kind of epidemic killing so many people.
Republican Representative Dave Baker lost a son to an overdose. Democratic Senator Chris Eaton lost her daughter. She called the penny a pill opioid tax reparations for all the damage drug companies did.
Like many parents who've lost children to this, I'm pretty angry about that. And I don't see any reason why the taxpayers should have to pay to fix this.
Well, a spokesman for the Pharmaceutical Research and Manufacturers of America told us today the opioid tax ignores factors that led to the public health crisis. They say including the influx of heroin, counterfeit fentanyl, and other illegal drugs, and that it fails to recognize existing funding available for treatment and prevention. The group also says this tax would unfairly penalize and ostracize vulnerable patients. So it's clear there's going to be a fight over this, and the drug manufacturers are not going to have any of it.
All right. Thank you, Pat.
Thanks, Pat.